This is my 32-year-old male client with no explanation of why he developed pain. At what point did you start to have low back pain?
Started a few years ago and just progressively got worse.
Okay. Now, of course, you did have some ski injuries, right?
I had like a fall once, but it mostly hurt my wrist, and I guess I landed on one of my sides.
Okay.
But afterwards, felt no immediate difference.
Okay.
And still
And
remain
any other
active.
injuries as a kid? Fell out of a tree, a bicycle?
Not that I know of. Yeah, no, not that I can recall.
Okay. All right. So the pain in your back started to develop when?
Um, Probably in 2020, I started getting like a mild lower back pain um, around my lumbar spine, and would do like a lot of rolling out on lacrosse balls, but was able to kind of maintain regular activity. And then starting a year ago, the pain started to really increase, and I had to limit a lot of my physical activities.
All right. Um, on your first day yesterday, we found a lot of things with your pelvis and hips, and your internal rotation on the left hip, and I use a log roll test. It was, if I recall correctly, wasn't it quite free on the left, about 30 degrees with a soft end feel?
Yeah, although initially, I think before you did anything, both sides, you said
Both
both
sides
sides were
were a little
pretty,
bit tight. So I think it had
pretty
about
restricted.
30 and it was a hard end feel.
Yeah,
And on the right was only 15.
yep,
And we were able to restore 45 degrees on both sides.
yes.
Okay. Um, Today, the left was still restored and the right was back to 30 degrees, but still had a soft end feel. We treated it again and we gained 45 on the right today. Okay. It is really interesting, but you had zero hip extension on both hips. And we restored that yesterday.
Mm-hmm.
Okay. And what was your response to what we did yesterday?
You mean emotionally?
No, no,
Oh,
like
yeah.
physically, more physical.
Yeah, so physically, I was able to walk with a normal gait, which was really impressive. I've been walking with a lot of pain for the past couple of weeks, where every step going, especially on the right side from extension, carrying it forward, would be painful or would like result in pain after a few minutes. And I felt kind of like I was able to walk with a fairly normal gait, or at least without a limp now.
Without what, please?
Without a limp.
Okay, without a limp. Very good, very good. Um, and how did you feel emotionally?
Uh, pretty ecstatic. I think being mobile is like just so important. So being able to feel like I'm walking normally again and kind of feel like uh, stable in my walking is like pretty fundamental.
Very good. We also treated your pelvis, but I'm not going to elaborate on that today. And you had blocked mobility in several directions with passive spring testing on the pelvis, and we restored that motion. Today it's all normal, but I want to focus on your gait. And I think that even before we do that, let's have you lie on your stomach. So the one thing I haven't really been able to impact to a large degree is the discomfort in your low back.
Yeah.
Are you uncomfortable now?
Um, Very slightly, I can feel a little discomfort
Okay.
on either side.
Okay.
In the muscle.
And if you were to stay on your stomach, how long could you stay?
Usually I could probably stay at least 15 minutes in this very pre-neutral position.
Got it. 15 minutes. Okay. Now, can you bend your right leg? Bend the knee? And what happens there?
I guess the bending, if I go like past this point, I start to really ramp up the discomfort.
Okay.
on this right side here and around the spine.
Okay, so provoke it just twice. Yeah. So if you bend that knee, to about 115, 20 degrees, 115 or 120 degrees, that bothers your back.
Yep.
So just slowly and gently bend the knee up, bend it from just 90 degrees and bring the heel towards your buttock. Do it a couple of times. Quite early on, I see a subtle shifting in the pelvis. Let me do it passively, okay? So just relax. Right there, we get pelvic motion. Okay? And I implicate the hips in inducing that. You have glorious hip extension that you did not have yesterday. Lie on your back, please. You favor external rotation in the right hip when you're laying on your back. So it points out 40 degrees maybe, whereas this one looks more on the order of 15, 20, looks more like 20. Okay. Now, internal rotation, I use a log roll test. Okay. And I can take you to about 30, 35, and I can spring it, and it does have some spring at the end. And this one has a greater range and a soft end feel. Okay, I'm gonna put the phone down, and when I roll at the thigh and at the tibia, I get full 45. If I just push on the tibia, I don't quite get that range. Okay, let's have you walk. Just go halfway and back. Good. And then go one more time, please. So looking at you walk, go ahead, come back. Just stop. I wouldn't define that as an unusual gait. Mm. If I saw you walking down the street, I wouldn't be drawn to observe your gait.
Yeah, it feels much better. It's like night and day from what it was prior to seeing you.
Wonderful. And you'll note that your feet favor being pointed out. Yeah. Maybe 15 on the right and maybe 10 on the left. Or, okay? Yeah. Maybe a little less than 10. You do have some bowing in the legs, okay? Tibial varus, all right? We're going to play with orthotics with you. Lots of people don't need orthotics, okay? I have boxes of them, and I modify them, and I do not hand them out like candy. Last time I sold an orthotic was probably 9 months ago.
Oh, wow.
However, I think you might be one that might benefit from one. Yeah. So we'll experiment with that, but that's not the focus of this film. I took a long time to get here. I took 8.5 minutes to get to this point. I want you to now point your feet straight ahead. Okay, tell me what that feels like.
Previously, at least, normally pointing my feet straight ahead makes everything, I feel a little tension in my back, and it almost feels like my feet are internally rotated, even though they're pointing straight.
Okay. Can I see you walk with your feet pointed straight ahead? It just really affects your gait, doesn't it? What does it feel like when you walk that way?
Feels a little tepid, and like I'm like going forward like very cautiously.
Okay. I want you to now point your feet inward a little bit. Good. So just mild, and then I want you to walk that way. Now we really destroy your gait, don't we?
Yeah.
How do you think that would feel if you walked that way for 3 minutes?
I'm not sure. The carpeting is pretty nice and soft.
Okay, but it definitely
It
is.
definitely is not normal for me. It feels pretty odd.
Okay, now we're going to do pointing outward. So exaggerate that. Yeah, that's good. That's good. And then walk that way. And that's no help either. Okay? Yeah, that challenges your gait as well.
Mhm.
So, the body is wise and the body finds the best neutral for your anatomy, the joint shape, yada yada. Okay? So I'm not here to teach you how to walk because you already find an efficient way to walk. And the body does that. The body has that wisdom. Okay? I just wanted to do this as an experiment and see what happened. And so I think what I would summarize is that you have a unique development in pelvis and hip, such that there's a limited amount of freedom in terms of internal or external rotation that you can impart while you walk.
Yeah.
Most people, I can walk that way. You could film me, and I don't think you'd see a huge variation in my gait. Okay? And somehow this connects to your lumbar spine. When you're on your stomach, your lumbar spine hurts in about 15 minutes.
Yeah.
Okay. That could be a developmental issue. You've had lots of input from other clinicians. How much physical therapy have you had?
Probably 6 months at this point.
Okay. And at the 6 months, were you going twice a week?
It was once a week.
Once a week? Okay. And they gave you stuff to do at home?
Yeah, variety of things to do. Doesn't work. Different things. Kind of guess and check just to
Guess
see.
and check. I like it.
Yeah.
I like it. Okay. And you had other treatments as well?
I also sought acupuncture care and chiropractic care.
Okay. And how much chiropractic?
Also went about once a week for 2 months to see what effect that had, and didn't really notice much of a benefit.
Alrighty. Okay. Well, I think that there's some input in some, developmental asymmetry in your body. I can see it just looking at your tibia, and I wouldn't pathologize it, except to the degree that we can make improvements that help you.
Yeah.
Let me phrase that differently. I've done some treatment with you and we've improved your gait, and that's probably as far as I can improve it. Okay? And I'll teach you how to keep those gains of mobility in your pelvis and hip. I will teach you some exercises that emphasize flexion of the lumbar spine. Okay? I will experiment with orthotics. But there are some limits. I'm not going to be able to make you walk with your feet pointed straight ahead.
Yeah.
I'm not going to make you walk with your feet pointed out. That's a design limitation. Okay? But in the back of my mind, I have this concern that could you have an inflammatory arthritic process called a inflammatory spondyloarthropathy? Okay? And that comes under the domain of rheumatology. So I would like you to see a rheumatologist and get a workup. And they have some medication that can be very, very helpful if you have that. So that's under their expertise, and that will be one of my recommendations.
Sounds good.
So any questions?
No.
Okay. When I do a scour test on your hip, you have surprisingly good motion in that context. So I don't think you're this hip begging for surgery. I don't see that. That's not what I'm, perceiving. So it'll be an interesting thing to see what you learn by seeing a rheumatologist and see if that venue is helpful. So truly interesting presentation. I didn't elaborate on some of the unique things you had yesterday in the pelvis, but I think we'll close here under 15 minutes. Thank you.
Yeah.